one nation, under God, indivisible, with liberty and justice for all.
Thank you, everybody. Doesn't look like we have anybody in the room that needs to be introduced, right? So we will talk about the minutes. Has everyone had a chance to review the minutes?
I'll second it.
All those in favor?
Aye.
Opposed? It passes. Okay, we're gonna get right into resolutions. HS1 is a resolution awarding a professional services contract for consumer in-home services. My understanding is this is for the hard-to-reach populations, right, in the rural areas. Sarah, would you like to explain it?
Yes, we have had,
Oh, yes, we need a
Yeah.
motion.
Second.
Frank's got the first.
Second.
Thank you. Thank you for that.
we've always had some issues with getting aides. This is for having an aide in the home for our seniors for personal care and housekeeper chore type services. So several years ago, we started the consumer directed model, whereas we have a fiscal intermediary that pays the aide, but the participant finds their own aide. If they can't find an aide, then the agency has offered some assistance with it, but that's what the model is. It's if it can't come from an agency like Staff Kings or Nessentia, then the participant, if they have a family friend or someone from the church that can come in and do those services for them, they're the one that's in charge. They make the schedule. They work with our staff to make sure that the aide is trained and that they're doing everything that they need to, the service plan that they establish, and then the agency, which is Arise, and now we're asking for Access CNY as well, they would be the fiscal intermediary, so they would be the payment piece. They would bill us, but they would be the one that does the payroll for the staff person.
So, just for a little more clarification, an RFP was sent out, right? There were 4 agencies that responded,
Yes.
and not only were the 2 lowest bids chosen, but also they're the closest, right? So there were some out of the area.
Correct. We have to, any of our contracts have to be monitored annually for the funding that we receive from the state. So we have to go on site to the agency and monitor case files and how they do business to make sure they're doing it the way it needs to be done for us to receive reimbursement. So these 2 agencies, Arise has been here in Oswego County for a number of years, and Access CNY, they're in Syracuse, so not very far away, but they're going to have a local office in Fulton, which any day now we should be hearing that it's open.
Any other questions or further discussion on this resolution? All those in favor?
Aye.
Opposed? It passes. Okay, we'll move on to HS2, which is a resolution authorizing a budget mod for the Office for the Aging to accept New York State Office for the Aging Senior Nutrition Educational SNAP Ed funding. Sarah, would you like to discuss this?
Motion.
Oh, we need a motion, sorry.
Second.
Thank you.
Certainly, we have received this funding for several years. It formerly was called SHINE, Senior Health Information and Nutrition Education. It's now SNAP Ed for seniors. As part is federal funding, so we were told that our last year was going to end September 30th of 2025. The state had some funding that was remaining from other counties that didn't spend all their money, so they reallocated it. We didn't know for sure how much we were going to receive. We finally received our notice of grant award. We're receiving $92,000. Our registered dietitian has remained has been providing services from October forward. but this is going to be putting money back into our Title IIIC, which we use for registered dietitian funds, as well as in the SNAP Ed line, so she can do the remainder of her education through September 30th.
Great. Anyone else have anything to add? Questions?
So what was the appropriations? for
Joe?
that?
Go
I'm
ahead.
sorry.
That's okay, go ahead.
What were the appropriations from last year?
We received $118,000 for the 24,
24,
25 season. Yeah,
So you're down like 20 grand?
right. But we have never spent our full allocation. Beth, our registered dietitian, I don't want to say she's inexpensive, but she's not as expensive as some other dietitians in other counties. And this is a tri-county. She does, it's based here in Oswego County, and we receive the funding for it, but it's Oswego, Lewis, and Jefferson County. So she goes to all 3 counties on this. And again, we've never, last year I think we maybe spent $90,000 of it. So I do not fear that we would go over or up to the 118 that we received previously. But if she did get close to that 92,000, then we would, as long as the grant has been fully executed, the items that she needed to do, which will be, then we would discontinue earlier.
So that money comes from the state, but it comes through the government to go to the state and then to us?
Correct.
Understood.
So, one question. So with the dietitian, she's the one who's designing diabetic, renal, and all these different kinds of diets that are.
For this grant, she has an established workshop or evidence-based program that she does. So they're called the 10 tips. So she goes out and does 4 education programs. She does them twice a week for 2 weeks over 10 different locations. So there's 6 locations here in Oswego County, and then there's 2 in Jefferson, 2 in Lewis County. But she's the same dietitian for our nutrition program that's part of congregate meals and home delivered meals that do, if somebody needs some additional nutrition counseling, she does work with them for that.
Okay, great, thank you.
All those in favor?
Aye.
Opposed? It passes. Thank you. Thank you. HS3 is a budget mod authorization for DSS to accept Transportation Initiative Program. Lee, would you like to talk about this? Motion, please, to discuss.
Second.
Second? Thank you. Frank, thank you for keeping me on task.
So this is accepting $19,598 in federal funding to support transportation for individuals in work-related programs. You can see that a fact sheet was attached to this one, and it is the federal TANF block grant is the funding source, and the purpose of funds to remove transportation barriers to prevent people from obtaining or maintaining employment. And so the key benefits help support employment outcomes, reduce long-term assistance dependency. There is no local tax impact on this one, and it strengthens workforce partnerships. It does allow transportation supports like gas cards, mileage reimbursement, car repairs, insurance, registration, licensing, driver education courses, and public transportation enhancements.
And this is strictly for people on temporary assistance?
Yes.
Yeah, this is actually funding that's allocated to workforce development. So when
Okay.
workforce development split off from our programs, the agreement was that these funds would still come in, we would accept them, and then workforce development would utilize them to help strengthen, that working relationship and to ensure that people could sustain their jobs based on this funding.
Any further discussion on this resolution? All those in favor?
Aye.
Opposed? Okay, it passes. HS4 is a resolution authorizing a budget mod for the extension of a contract with Barnum. Do I have a motion?
Second.
Thank you.
So this is,
You're up again.
yes, so this is a Farnham contract extension for our drug and alcohol screenings.
And it extended out until when?
To May of 2026.
Okay. Perfect. So the county is required to fulfill this.
Yes, it is a mandated program. And it screens all adult TA applicants and recipients for substance use disorders.
Does anyone have questions about this resolution? Richard?
Yeah, if a person being tested and they have a problem not passing, we have a way of following that person to services, correct?
Yes. Do you want to expand on that?
Yeah, so, so this contract is to allow KSACs to do that screening at our office. And then if they test positive, then they would be referred on to Farnham, and they would determine whether it's inpatient or outpatient treatment that they would need. It is a condition of eligibility. So that's why it's a mandated program, because that screening will then say whether that person then has to go on for further treatment.
Thank you.
I have one question.
Thank you for that, Ryan.
You said inpatient treatment. Do we have a facility set up to send these people if they need inpatient treatment?
So there's facilities locally, like, in our county now, but what they will do is they will connect with other facilities to see what is open, and then Farnham will work with the agency to then refer.
Okay, and I guess a follow-on question to that, the availability of beds in these facilities. Do we have a specific number of beds that are available for citizens of Oswego County? Do we have?
There's no specific that's like allocated to Oswego
Right.
County residents.
That's my question.
No, so it's kind of where is there an opening and where we can refer them.
Okay, thank you.
Does anyone else have anything?
In looking at the numbers, it was an increase of about $7,600, but I was noticing that about $11,000 was being reallocated. I didn't understand.
I'm not sure if Jackie, you can answer that question or not, and may have to get back to you on
Yeah.
that one. But can I answer? Yes, you should.
Why?
The money that they used was within their own budget. Okay, so they took the money from their own budget. The money that they used was originally in a line that would have had more federal reimbursement than this project has, than this purpose has. So because of that, they had to take more out of that line to reduce the federal share. But they took it from their own budget, so what we did was in order to make up the difference of what was no longer available in federal reimbursement in our first pot of money, was so that they could take that money and move it away. So we basically eliminated some federal reimbursement that we would have received if had she used it in the first instance. They are not reimbursed federally for safety net, drug and alcohol testing.
Does that clear that up for you, Chris? Okay, good. Sounds complicated. All right, Richard.
Yes, when you say when there's an open bed, that would be like, for example, like Tully Hills or Conifer Park in Scotia, those type of facilities,
Yep.
which are very professional.
Correct. Yep. And there's even a facility in Pennsylvania.
No,
if they have that.
they're all
Obviously, we try to get closer.
Sure.
The closer the better. But that's all work that Farnham does and their KSACs do because they're trained and knowledgeable of what is out there.
So it's basically, when a bed opens up in one of these facilities, we can get that individual there. We will get them there, I'm quite sure of that.
Correct. But outpatient starts.
Yeah, that's a different animal.
Yep, for sure.
Okay.
Okay, sounds like we're ready to vote then. All those in favor?
Aye.
Opposed? It passes. Thank you. HS5 is a resolution to transfer funds from insurance recovery. Sounds like there was an accident. So
Yeah.
motion to discuss. Thank you. Second.
Yep, so we had an accident with the vehicle, and this is us just collecting the insurance for it.
All those in favor?
Aye.
Opposed? It passes. HS 6. This is gonna be you, Ryan, right? This is a resolution authorizing the County of Oswego to accept funds from the Central New York Community Foundation, which is a $1,500 stipend for hosting the Centennial Oswego Participatory Budgeting Project at Camp Zerby. Ryan, tell us about this.
Motion.
Second.
With an after motion, thank you.
So I'm glad you read that because I typed that enough in it.
Tongue
It was
twister.
a few times. I actually have a flyer I'll pass around. They contacted me recently that they're going to be doing this at a couple of different sites. I think Fulton has one too over the next couple of days. Ours is at Camp Zerby tomorrow and Wednesday, where community is encouraged to come together. They do a table session to talk about needs within the community and how they could use money. $75,000 is going to be awarded to a project, so I may or may not have people twisting certain stories in their ears while they're there tomorrow. But this basically money is set for us to, as Youth Bureau, to provide entertainment for whatever kids are at that event tomorrow. So that's what we're giving us to do. So we'll be replacing equipment and things like that way. But it's a nice gesture.
I'm sure you could use it.
We could.
Anybody have any questions on this? Go ahead, Ryan.
Nice to see you.
Oh, so you have Fulton tonight?
Yes.
Okay, so then it's going to be tomorrow.
Yeah.
Yes,
See
yeah.
you tonight, folks.
Yeah, because
From
yeah,
5, I think, or 5 to 8.
yeah, I think it's probably, yeah, because we're 5 to 7. Okay, so it's probably the same thing. Yeah.
Perfect. All those in favor? Opposed?
You do get $1,500.
For reporting departments, we're gonna try something a little different today and go in reverse order. So we're gonna start with Youth Bureau updates.
All right, so a couple things. I have a list of some job openings that we have at Camp Hollis that I can pass along. If anybody knows of anybody looking for a summer job, we also have positions available at Camp Zerby and at Legends Fields as well. Our webpage should be up to date on that, but those are some ones that Zach gave me that he has not hired yet at Camp Hollis. Numbers-wise, we're doing well with filling up our campers. Right now, from where we are, we're at, for the overnight camp, we're at 52% capacity, and at the day camp, we're at 62% capacity. So June first week of May, we expect to be close to sold out by the end of the school year. We'll start to see numbers really kick up at that point in time, but honestly, doing this as long as I have, I like the numbers where they are right now because, like anything, you sign your child up in March to go to camp for 3 weeks, and by the time June and July comes on, I think the whole world is different. It just distracts on the numbers. So signing up now is better for that. We just did a big cleanup at Camp Hollis this weekend we had Constellation come in and they worked with AmeriCorps for Earth Day. They do that yearly, so that went well from that. Next week, we're going to be a part of Youth Government Day, so hopefully you'll all be at Camp Hollis to do Saturday Nutritious Camp Hollis lunch while you're there and see some different things happening. Then the next day, we have a cleanup day at Independence Trail. We work with the Friends of Rosemont Gifford Sioux and City BOCES to do different improvements on that day. Things from trail cleanup to signage, benches being built, all sorts of different things will happen at Independence Trail that day. Friends of Rosemont Gifford Sioux is great to work with. They bring a lot of different volunteers as well. But you always hear stories from the city, whether it's CPAC or whomever it may be. The city has over 100 students going that day to help out with the different trades pieces of it. So that'll be happening. When circling around a little bit, our rentals, again, our building capacity of 38 rentals already confirmed for Camp Hollis this year. We have a first aid training coming up June 1st for CPR and first aid. One of the reasons why I tell you that is we do share that because we have the Red Cross come in here, we'll work with other camps and such so that they can get their counselors to maybe your municipalities or anything, getting them certified as well so that they can go along with that. And then on June 8th, we'll have the wilderness first aid training as well. June 17th and 18th, we'll do a ropes training, ropes course training at Camp Hollis. So again, we work with other camps. I know, for example, St. Creek, they've already booked to have their staff there go along with that. We submitted a proposal to Workforce for a trail crew again this summer to work at Camp Hollis and usually Camp Independence Trail as well. We currently have a young person working with us for 13 weeks, and they've been shifting from Camp Hollis to Legends. Keeping my fingers crossed, later this week we will have opening our pool at Camp Hollis. There were a couple things that concerned us a little bit when we closed it. We're hoping that it's not a big deal. We're rolling a little bit early this year to find out cases and everything that we need to offset that. Different things such as at Legends Fields, we're going to be talking about banners. We have 26 banners sold so far for advertising. Just for an example, this week Rudy bought 6 banners, so they bought one for each field, which I think also, aside from the revenue line, that it helps us. I also think the local community, when we think about Legends, a place like Rudy's is also, doing some advertising. So they're doing what we're asking to do, they're supporting it, and then hoping people will support back to them when they go to use the fields. We've had, I don't know if you saw our Facebook page the other day, but Friday night was busy. Both of the Fulton High School girls softball teams were playing up there. Every field had something going on Friday. This past weekend, Little League was up there for Oswego because, shocker, their fields were not ready. When I say shocker, not them, but everybody's had such a wet year. The turf has been really beneficial for us for that because fields are very hard to go about. One given day we had, just for you to think about, we had Mexico, CBA, Oswego, FM, and Fulton all playing at Legends at the same time. The Fulton Fury, which is a travel baseball team, they've been using Legends for several field. So they've been practicing up there weekly, and they've had some games up there. The Mexico School District has been up there. Fulton has been up there, obviously Oswego. And then the City Club baseball and softball have also been using Legends this year. Our girls softball program started recently. They started, actually tonight they will be going. So they have 56 girls who are aged 6 to 12 who have registered. A unique twist to that this year is we have 4 teams up there, but we're going to be playing other teams from APW, Mexico, Fulton, Kiwanis, Phoenix. They're all going to be coming up with 12-game rotating schedules that these teams are going to get a chance to play at Legends against some of these girls who will be playing kind of as Legends home team has to go about doing that. We have the Challenger Softball Mentor program that will be starting July 1st. We have a new program which is Bridge League Baseball. So if you are somebody who has a child involved in your life who plays Little League Baseball, you'll always see that they are done traditionally by the 4th of July, give or take maybe some all-star games. So you think the whole summer is going on and what more can they do? Well, we have a new Bridge League we're putting together where we're going to have games up at Legends where kids can sign up and make these so you'll be busy all summer.
I know.
Going up there
Thank you.
Adult softball will be starting next week. We have 10 teams registered to play up there. It's bringing in additional revenue. Of course, this weekend is the City versus County softball game. If anybody is participating in that, then we have Saturday. I'm finalizing quotes for scoreboards for up at Legends right now. I'm waiting for one more piece to come in. Field 5, the sod is down. If you get a chance, go out there and take a look at it. If you haven't seen pictures, it looks amazing. That was the field that we had to extend so that varsity baseball could play up there and the college. The sod went down last week, so it takes a couple weeks to take, for lack of better words. So we're hoping that the high school varsity teams will be able to play up there at some point in time this season, but if not, when Champion starts their tournament, they'll definitely be able to use it. I put in a proposal to fix the field lights this week. We always have bulbs that go out in the wintertime, and obviously being on big poles, There's nobody that I'm aware of who works in the county who can fix those things because of many reasons. So that'll be being done. I'm still trying to determine, working with Buildings and Grounds at Camp Serby, about the underground water tank that every once in a while when we get heavy rains, we can have challenges with that. So I'm working with that. Really hopeful that we win that $75,000, so then we'll get that with replacing that. But other than that, Camp Serby has been busy with upgrading our basketball courts, pickleball courts. We're getting these tee boxes and signage to go with our disc golf course. We also have a new program at Legends this summer. This will be our summer camp. It's different theme weeks that they have going about it, the way you work about it. That's a free program. To do it, there's different ways in the health department that have to go about doing things, so that's how we decided to go this year. Our numbers at Camp Serby are very high right now. We're getting very close to being able to max that out. We are talking with a couple municipalities right now about potentially combining programming at Camp Serby. So if that happens, that's going to make it much bigger than it is right now. So that's down the road to go about as we talk about that. We have a new program. It's called SALT, and that is the Student Athlete Leadership Team. And that's a group that is made up of high school students who play sports, but how they get together, talk about different things, expectations on the field, off the field, volunteering their time, doing different new things. So I'm sure many of us are involved in different community activities, golf tournaments and such, always looking for volunteers. This will be a list where we can get that list out there and we can draw from that. I have a New Vision student from the high school who's working with me on that, and she might have a very famous boyfriend who's from Bolton who plays basketball, so he might be somebody who can help me out too, to go along with marketing of that program. So we're going with that. Different things my staff are working on right now. The Randy CAP program, which is the Moons Under the Moon, Traveling Arts in the Parks, the Hannibal Events Committee. Recently we did our last Easter egg hunt, which we're doing different things. Thank you, Winston, so much involved with that event. Harborfest, being involved with the children's park, we're busy planning with that. Our Splash in the Reading program, again, that the school year is winding down soon, so between that, the reading club, different things happen with that. We recently did a spring color cup at Camp Hollis over break, kites in the sky. Our Leadership of Sligo County Youth Program is getting ready to graduate, so that will be a big thing coming up with that. They recently did a community service project and they collected $1,700 for the homeless for OCL, for Society Opportunities. What do I have up here? Our AmeriCorps program going into summer is always very busy. We are getting close to being to capacity at that for this year, which is good. They just did I Love My Parks Day as well. And I think beyond that, the only things I can give you is next week, or not next week, I'm sorry. Next month we'll be doing the Sligo County Youth Career Summit. This is, I think, the 21st year of doing so. And that is for our 8th grade students to go to the fairgrounds. There'll be a whole bunch of different careers that will be there to talk to our young people. We picked 8th grade because they're going into high school. They can kind of target the path they may want to go in and then learn about programs that we have along the way to help them understand, learn about what they may want to do. We always put a unique programming effort together. I don't know how often you deal with 8th graders, but you have to keep them entertained, and the capacity of time sometimes can be short. So you have to make sure that you're, like the nuclear plant in the past, Constellation has electrocuted a pickle. They bring their robotic dog. The Sheriff's Department had a robotic dog there last year. National Grid is bringing a truck this year. Anything it is that will get the interest. The state police brings their K9s. Things that get a young person interested in a career. We'll have drones there. We'll have anything and everything we can pick up. My office has sent out invites. If you haven't received one and you'd like to go, please let me know. We can get you on the list. I know people like Sarah's there for OFA every year. And Sarah and I have been talking a little bit, our staff have been talking about doing some neat intergenerational programming, about how we go about it. And one of the things that neither Sarah or I can take credit for, but our staff did, is they're going to create a podcast between a teenager and a senior, and they're going to go about talking about different things, which I think is kind of cool. And lastly, our community services directory is being updated. So that has not been done in a couple of years, and I have staff working on that. So if you get an email, if you're not in the directory, you'd like to be in there, please let us know. But if not, update it. You never know how much that is needed until you miss a year in updating it. You find out from everybody. Well, boy, you missed a year. So anyways, that's happening right now, and that directory will be updated. It's all on the county webpage. It works right down there. For those of you who've been around for years, it used to be able to get a paper copy, but those are costly. So I really like the digital copy because it's very easy to update, and you don't have to print 8 million copies.
got a lot going on.
Bundle 800 of them to DSS.
You got a lot going on.
So I'm sure I forgot.
Okay.
Sarah, what do you have today?
Well, I have a few things, but not as many as you decide. You know, 'cause we
I'm
already
just glad you went quick before Lindsay declined to get me with any questions.
Exactly.
Well, finally, our dining center will be opening next week. We do have an open house on Wednesday, and anybody who is available to drop in, it's between 11 and 1 o'clock. You can come see the kitchen where it will be. OCO will be there with some snacky foods, but certainly feel free to drop in. And then the following week, we will officially be opening on Tuesday, the 12th, and we'll be open going forward unless it's a holiday or something specific happens. We're going to close every Tuesday and Wednesday between 11 a.m. and 1 p.m. For those older people that are age 60 or older, come in and have lunch, have some socialization. With this program, there's no assessment needed. They do have to be 60 or older, but they do have to make a reservation because they need to know how many meals to have available for that day. May is Older Americans Month, so we have reached out to the couple that we nominated for our Seniors of the Year, the O'Briens. I'm waiting to hear back from them to see if they can attend the legislature meeting. If they can, then we're hoping to be able to give them a proclamation, but we haven't heard back yet from them. And also, we'll be, if they're available to travel to Albany, then we'll be going to Albany for them to receive recognition from the State Office for the Aging the Tuesday after Memorial Day. I think it's the 26th, May 26th. So, last meeting, I had mentioned that the State Office for the Aging Nutrition staff are going to be coming in to do monitoring of our meals program, both congregate and home delivered. They did come in. They were with us for 2 days, and as far as I know so far, we haven't heard anything. They were very, as they always are, they're very impressed with how many meals that are going out on a daily basis, whether it's home delivered meal or at the congregate site, and to see the OCO kitchen as well. They said you can tell when you walk in the kitchen immediately whether it's operated correctly or not, and there were no questions. They're very impressed with the operations of the kitchen. I'm pretty sure we will probably receive some feedback on the nutritional value, because as part of the Title III money we receive, the federal grant money, the meals, because we're providing 2 meals a day for home delivered meals, those meals are supposed to contain 2/3 of all of the daily recommended values and daily. And it's hard sometimes to hit all those nutritional values daily. Weekly, it's a little easier, but daily, sometimes it's a little hard, especially with the cost of food and with the recent changes with the fiber values and potassium and vitamin D. Some of those numbers are hard to reach. That is the only actionable item I believe that they may find, and we can only do what we can do And I will bring that back to you and let you know if that was actually a finding or not. We do have them coming again the end of May. So May 19th through the 21st, the State Office for the Aging will be on site reviewing all of our programs that we receive funding, both federal and state funding for. And I was asked, well, you know what, we're going to be on site and we want to try to combine visits now. So, you know what, I'm going to send the fiscal team as well. So we'll be getting a fiscal audit at the same time as the program audit. So we'll have the nutrition, fiscal, and program audit all this year, and then we'll have a couple of years where we can some breathing room. But we're going to be pretty busy with getting documents together for those evaluations and audits. It's always flying colors. We've never had any true issues in any of the programs that we provide, but it is a lot of getting documents together. And this year, this will be the first fiscal audit since we've had Munis, so we don't have as many paper documents. We've been able to always say this is the voucher, reimbursement voucher we sent to the state, and then all paper documents that they can then match up. Now it's in Munis, so we're trying to reach out to you, Veronica, for any suggestions on that. But I did say it may be a little bit of a hurdle for us to get all of those documents together, but they're aware of it in advance. I had mentioned that at the last meeting, that we're doing the Aging Forward Caregiver Conference with 3 other counties, Jefferson, St. Lawrence, and Lewis County. It'll be at JCC. That's on May 28th. Reservations are required because each county gets 50 spots, and we don't want to take more spots than we can, or if we have any spots that are available for other counties that they can utilize, then we'll share those spots with other counties. But it's an all-day event at JCC, and I did work with Heather Snow at Mobility Management, and there will be a bus. We're going to have a park and ride bus in Class Guide in the Big Lots shopping center. So anybody that doesn't want to drive to JCC or up to Watertown, they can, park the car and hop on the bus and take the bus back and forth. And the Alzheimer's Association has stated they'll pay for all the meals for any Oswego County participants. There's fundraising that's being done by the other counties, but the Alzheimer's Association said they would cover all 50 meals for any Oswego County participants. So we are also, let's go in chronological order. We have a pet adoption day. So I don't know if you all know of our animatronic pets, but we have cats and dogs as part of our social isolation to help with the social isolation for older people. Many times they've had a pet all their lives, but now they may have moved into an apartment that doesn't allow pets, or maybe they can't take care of a pet any longer. So we have animatronic pets and dogs, so we're having an adoption event on Monday, next Monday. So we do have a little screening process because we don't just give them out to anybody. We have to make sure that we do a loneliness scale, and then very rarely do we tell anybody, no, you don't qualify. If they're looking for that pet, then we do get it out to them. But it'll be on the 11th, and you can certainly also stop in and take a look at the animatronic pets. We'll have all of our samples out, and hopefully we'll get a lot of them distributed out in the community. We have purchased some in the past, but the State Office for the Aging does an order every year as well. So from their budget, they say, well, how many do you want? So we're going to be getting some additional pets in as well. No more cats. It's just going to be dogs because of the chips come from China, and there's been a snafu with getting the chips for the cats. So it'll just be dogs that will be getting it. We also have a Caregiver Services Information Day. Our Caregiver Services program, we have a lot that we do, but a lot that people don't know about that we do. So as part of that, we do have a lot of toys or tools to help caregivers So we have Elizabeth, our caregiver coordinator, has set up a training day to let the community come in to go over all the services that we have, from support groups to counseling to our evidence-based tools for caregivers, our animatronic pets, our respite program, our Alzheimer's respite program. So to give an overview of everything that we have to help get the word out to caregivers to try to eliminate or reduce some of that caregiver stress that people go through. Let's see. We had ordered 5 Claris tablets, and these are for our caregivers as well. The tablet itself is preloaded with, you just push a button and it'll get you to like our TruAlta, which is a caregiver tool online training. They come preloaded with that, but also ways to communicate, so you can email from it, you can contact people, but it's for our caregivers, because they many times can't get out in the community. They're caring for a loved one or someone else, so this is a tool for them to stay connected. And it also has Verizon internet connection, because that's sometimes an issue for people too, where they don't have internet, so they can't access all the training and opportunities that are available. So these 5 Claris tablets, we're getting them out to caregivers in the community. And we also have Silver Shield. We received licenses for these from the State Office for the Aging, so again, this doesn't cost us anything. But what Silver Shield is a monitoring tool. So you get a text message, you don't know if it's legitimate or not, you can reach out to Silver Shield, text Silver Shield, and they'll get back to you and let you know whether it's a legitimate source. If it's not, it'll give you tips on what you should do, how to stay away from it. So we have those licenses, and again, it's for text messages, but also for email messages. So we have some of those to get out in the community. Again, it's a scam assistant providing a simple way to check, report, and share suspicious messages or situations. Now it's spring. We do have a new memorandum of understanding to get some ramps out. We purchased ramps in the fall with some of our unmet need and the last of our ARPA funding. So we have 3 to 5 ramps that we can get out in the community, depending on how long the ramp has to be. Will depend on whether it's 3 ramps or if it's 5 ramps. But we're working with Ontario Accessibility Solutions to get these ramps out in the community, hopefully. And we'll get them out pretty quick and free up the space that at Buildings and Grounds right now where our ramps were delivered to. And the last item I have is our chat benches. The last 2 chat benches, Happy to Chat benches, will be placed on May 21st. And for new legislators, you might not know what Happy to Chat benches are. They're another tool in our arsenal to try to address isolationism and loneliness in our older population. And they have a sign on them that says Happy to Chat. So these benches are specifically, if you sit there, know that you're expected to engage in conversation. If you don't want to have conversation, you probably should find another bench. But if you want to have a conversation, regardless of how old you are, if you sit at this bench, that's what these benches are. There's a sign and there's a QR code on it, so you can find out the QR code. It goes to our website that gives a description of what the Happy to Chat benches are. This is something that was established in England, and it's been very well received there. And there's other Chemung County also, or Chenango County also has them there, but we have 6 of them. 4 of them are already out in the community. We have one in Pulaski at Haldane Center at the park there. We have one in Fulton at Veterans Park overlooking the river. We have one in Mexico. If you drive by, you can see that one because it's right by the gazebo. And then one in Phoenix at Community Park, which is in behind where the post office is. So these last 2, one will be up at our office and one will be at Shapiro Park here in Oswego. They're going to be placed on the 21st. And Nicole and the Mental Hygiene Division funded the purchase of all the materials for the benches, and City BOCES actually constructed the benches. So it was a joint venture.
Nice. Anything else? How did you choose these locations?
I reached out to the villages and the village mayors and the 2 city mayors and asked them if they want to participate, and then I let them kind of dictate where they thought would be the best place to put them.
I find it interesting. Shapiro Park was chosen over all the other parks.
Well, there's a lot of benches in other parks, and I was told Shapiro Park has a pickleball court, which is something that older generation really
No, I know.
really enjoys, and there's children there as well, so it can be intergenerational. So that was why Shapiro Park was chosen.
Well, thank you, Sarah. Eric, you're up now with Veteran Services.
So, first thing I got is in order to kick off our Dwyer program as best we can. We're doing a meet and greet on May 14th. We're going to have an OCO here or there in Fulton. We're going to do 2 events, one at 9 a.m. and one at 6 p.m. It's basically the same thing. We just want to make sure that we can get both the people that don't work and the people that do, or the people that work nights. We want to be able to get everybody. One of the big issues we've been pushing in our office is trying to get younger veterans in. And since a lot of those younger veterans work, having events at 11, 12, 1 o'clock in the afternoon are not really any good because they're at work until 10. My peer mentor, the peer mentor, Ward, he's the one that put this together. I would like to say that while he was doing this, he approached these 2 places to get the coffee and the donuts, which was the Dunkin' right there in the parking lot. The other one was the pizza place, the Pizza Hut. And both of those places donated the food and the drinks to the veterans. So that was unexpected, but it just shows you the support that the community does provide our veterans. Speaking of the Dwyer, Ward and I were both going to attend a conference that's happening out in Albany this week. I'm not going now because my recovery is not as far along as I wish it was. But Ward is still going, so we're hoping this will be our first time attending this, and we're hoping to really learn a lot about how other counties run their Dwyer programs and then network. The Dwyer program in a lot of counties is run by outside agencies, as ours was at one time. But we're really wanting to focus on those counties where the county offices actually run them, because when the county offices is running it, you don't have as much of the support as, say, an organization might have. For example, Clear Path for Veterans runs 4 or 5 different counties, but they're a huge, soon-to-be nationwide organization. And it's just going to help us to be able to build our program better so we can see what works and what doesn't. So when we come back from that, we should have a lot more of an idea on how we want to move forward with the program. The other thing I have is we hired a new VSO, but unfortunately, just prior to them starting, they didn't receive another job opportunity. So we are still down a VSO. I'm in the process of trying to locate another individual and hire them. The way that is affecting us, though, is the office that we had in the Oswego Clinic that the state took over. The individual that was running that office has since retired. So all those people that he was working with, all those veterans are now calling our office and coming to our office. So about every 3rd phone call, Ward will answer the phone and we'll hear the other VSO's name. And because he's left, now they're coming to us. So we're getting a lot more people into our office. Because we're short the VSO and Ward is the peer mentor, I'm trying to keep him out of that VSO realm so that he can just focus on this, which is going to be a lot easier once we get that other VSO hired. Our office, I put out a news release because of the conference this week. We're going to an appointment only for Wednesday, Thursday, Friday. We're going to go back to our normal Monday, but if things start picking up too much, we may have to change that just so that we don't get so overwhelmed that we can't keep up with the claims that we have. The last thing I got is the Fresh Connect checks that we do every year. It's a huge success every year. We've already been contacted by the New York State Veterans Agency. We've already taken the training, and now we're just waiting on the checks to arrive. Hopefully they'll be here at the end of May, beginning of June. that program has been so successful that we are already receiving phone calls and emails from people wanting to know, got the checks in, got the checks yet. So once those arrive and I get them all inventory and everything, we will send out a news release and we'll start handing this out to the veteran public.
Eric, who's eligible to those, to receive those?
Any veteran is eligible or their family members, but the booklets come, there's 50 coupons per book. Each coupon is worth $2, but you're only allowed 25 coupons, so $50 for. So it's half a booklet, but you're only allowed half a booklet per household. So you can have 10 veterans living in that house, you're only allowed 25 coupons. But if you have a veteran that has passed and he has a surviving spouse, we still offer them to them. If the veteran is homebound and he's got a son that takes care of him, that lives with him, the son is eligible, as long as we can show that the coupons are actually going for the veteran. So it's any veteran. I know the Office of the Aging does something similar. Our coupons are a little less restricted than what they get. So it's a benefit for these veterans because they can come to our office and get the $50 in coupons, and then they can go to the Office of Aging if they make an agent on it and receive those as well. And they're accepted at pretty much any farmers market around the states.
Great.
Madam Chair, I have a question.
Go ahead, Sarah.
I just wanted to say, yes, we will be receiving ours too. We haven't heard when. We usually get ours the end of June, beginning of July. Last year, we received 1,500 booklets and 5 coupons. We will not get that many this year, so I think we're going to have a lot of people that may be a little unhappy. They were using up the state was using up the last of their ARPA funds last year, so we got a lot of booklets. We're hoping for 900 booklets to get out.
Yeah, I will say
I'll let her finish.
with the first year we did this, we received quite a few booklets and we used them all and were able to request more. But the last couple of years, they really calculated how many they've given out, how many were used, and last year we were unable to get any more because not enough of them were being used. So this year we're really going to push for people to use the coupons so that, because it never fails to run out of coupons and then we still have people calling some people. And then you have to tell them, well, it's first come, first served, and it's too late.
Hey, all set?
Yes, sir.
I have a question for legislators in the room. What steps need to be taken to reestablish the county's Veteran Service Advisory Committee? There are several members of this committee that have shown interest in reforming the committee. It's been 4 years since the last meeting. Okay? And it's sat idle. It has sat idle for the last 4 years. I'm the outreach officer for VFW Post 569 in Fulton. We need to reestablish the vital veteran service with a new chairman. It's been 4 years since we've had a meeting, at least 4 years since the committee's had a meeting. This committee role includes identifying veteran service issues, awarding County Veteran of the Year, and honoring those who have made the ultimate sacrifice, providing a point of contact for VA veterans assistance, employment services for newly transitioned veterans on active duty to civilian life. I feel as a legislative body, we have done our veterans an injustice by letting this committee perish. I'm saying that as the only combat veteran on the county legislature. I think we need to reestablish a committee. I think we should look into it and reestablish this committee.
Okay.
With the chairman.
I got a quick question about that.
Sure.
This is the first I'm hearing of it. Why was this not added to the agenda so we could talk about it thoroughly?
Well, we could put it on the agenda for next month.
Okay, I would suggest we table that idea.
Sure.
And then talk about it.
All right, thank you.
All right, moving on. I think I skipped over our request to set the salary. Lee, would you prefer we do that before or after your report?
We can do it
Doesn't
now.
matter.
Right after
Okay.
Kate. Let's get to it.
Has everyone had a chance to review? This is something we need to vote on, right? Oh, just a discussion?
Yeah.
Okay, does anyone have anything they want to discuss? Because it will be voted on at F&P still said. No? Okay, so that means we can move on. Go ahead and do your reporting.
Okay. Okay, so everybody received their packet. Typically, we provide all of the departments' data and information, how we collect it. If there is something that you'd like that we're not reporting on, sometimes, an example, Rich had a couple of questions. We don't always tally the numbers quite how you would like to see them. We are going to be sending this out a week prior to this committee meeting to allow everybody the opportunity to view it before now. That way, if you have questions, you can reach back out to us, and then we have some time to get you the right answers, okay? But what I try to do, because that's a lot to go over, I kind of condense it to the highlights of what I talk about. And so we right now are doing some implementation of standardized reconciliation tools and required supervisory sign-off. This is internally ongoing contracted service delivery review in preparation for the projected 2027 fiscal constraints. So we are looking at the internal controls on what we can do, aligning services with the contracts for future budget conditions. Sarah and I have been very busy having meetings, reviewing all of the contracts, looking at what we can do. So there will be more information to come. We have a couple that will be coming up due in July, and by the end of the year that we want to bring to everyone's attention. Mental hygiene, expansion of crisis services, home-based crisis intervention. Helio Health is now accepting referrals. Court-based mental health navigator program in development. The target is for a July launch. State aid approved to support the 24/7 mobile crisis services for OPWDD population. So continuing to build out crisis response infrastructure with improved reimbursement alignment. Temporary assistance, SNAP medicated. This is integrated services under Gidget's side. Well, I guess it's a mix because we're talking about Medicaid applications. So Medicaid applications increased 77% through January through March. They've done a decent job of reducing the backlog by 22%. SNAP remains a focal point in current state and county budget discussions with potential cost shifts under consideration. Cost avoidance initiatives generated $413,000 year to date. High demand with measurable gains in efficiency. External policy decisions related to SNAP present potential fiscal and operational risks to counties. That's not just us, that's everywhere. Child welfare, CPS managed 226 reports with 188 closures. Active caseload remains elevated. 3 adoptions were finalized. Continued focus on high-need case coordination. So we have sustained volume with ongoing focus on permanency and stabilization. Child support enforcement, $3.8 million collected year to date. The county reimbursement increased 45%. Performance exceeds federal benchmarks in that program, so their strong performance continues to generate positive fiscal impact. Fiscal and finance, we have March claims, $5.1 million in total, 21% local share, $5.9 million in outstanding receivables, recovery efforts ongoing, operating with 16% vacancy rate. So fiscal operations remain stable with continued emphasis on reconciliation and recovery. Leadership, engagement, strategic coordination. So I am having a weekly standing meeting with Mike. Mike and I review things that are going on and support alignment on priorities with emerging issues. We do a CPAC meeting quarterly. We did review the bylaws. We are looking at that meeting in particular because it was a meeting that was created by the legislative body, and I don't think it's functioning the way that it was intended to function. So Sarah and I have been meeting with that team trying to look at the design of it. The intention of it was for that committee to be ran by the community members and for the community members to be identifying providers, stakeholders to be identifying the services and gaps within the community, and for me to report on it here at the legislative body. Unfortunately, I'm running that meeting, and that wasn't the design of it, and very little engagement from our community members. I have a lot of people sitting around the table. We were able to add some new partners, but when it comes to, we decided that we needed to create 2 subcommittees, and the people who are volunteering are the county employees. It's not the agencies themselves, and so I'm not sure if we need to reevaluate this committee and its function, but we've been talking about it. It's on our radar. I think all of us are very well aware of the unmet service gaps for youth mental health services, youth crisis services, respite services. Those haven't changed in the entire time I've been commissioner. So I'm not, again, for me to report out quarterly that we have the same needs we did last year and the year before. I don't know how purposeful or meaningful this committee is. So just wanted to put that on the radar that we're looking at it. I'd like it to serve a real meaningful function, but I think those persistent community gaps for housing instability, food insecurity, and those limited services for kids, they're just themes that aren't going away. Ongoing coordination with TIPCO regarding EVA expansion and state engagement strategy to improve access to case status information, and that's really for the expansion for under CPS because of confidentiality. There are certain things like footballer calls in and says that they want to know what their case status update is. We're not able to provide that. That's going to require humans to go back into the case file to get that information. So we're trying to coordinate a statewide commissioner level letter because now we have, I think there were about 20 people on that last EVA call. And so we're looking at doing a combined letter to nudge the state to look at the AI model. So I do have some upcoming meetings with legislator Ardomini and community partners, including Victory Transportation and Mary Curcio, focused on housing and shelter capacity. Department-wide contract review underway. So just, again, trying to be the bridge builder, active coordination, state and federal advocacy. Phil led the discussion for the participation in the New York State Association of Counties. I did attend that, and Phil spoke wonderfully about the federal changes that reduce administrative reimbursement from 50 to 25% beginning in October 26th. So that really was talking about a request for a 2-year delay in that to give counties the opportunity to figure out how we're going to take on that additional cost shift. So they're advocating for the 2-year implementation delay that allows fiscal planning, workforce stabilization, system readiness. Additional concerns include increased administrative requirements and exposure to federal penalties tied to payment error rates. So again, I know it's very complicated. There is a lot involved in that, but I think that the county Phil's group is doing what they need to be doing to protect these kinds of services for the community. So it would be a significant and immediate fiscal and operational risk. And so I think we're taking the right stance. Phil, you did a great job. Compliance and audit activity. I had a little blip, but Tiffany gave me something a little bit more thorough, so I'm going to jump over to hers. Before I do, though, I would like to, I've come and sat around the table and we've talked about crisis respite for kids, challenges that we're having. with barriers in the hospital. So this is not a new conversation or situation. It's just an ongoing one. Currently, we have a 7-year-old child that is being tossed around like a hot potato. And I think that, again, it's a systems level issue. I don't believe it should be falling to a DSS level issue, but when parents refuse to pick up their children in the ER, they're defaulting to the hospital for care that isn't appropriate, and thereby, way of not picking them up, defaulting to Department of Social Services. We're not the only county that finds himself in this predicament. My background for the first 23 years of my career was in services that were provided to people with disabilities, and it seems like the majority of these kids that are being arrested, they're using the word abandoned, which I don't know that I appreciate, knowing the complications and the difficulty it is to raise a child with a disability. But like in everywhere else, funding streams are extremely limited in this world. And so I just kind of want to highlight a couple of things that have changed. So back when I did programming for community habilitation, respite, in-home care, children under the age of 20 were being approved for community habilitation services. It's a skill building program, works on social skills. We would work on morning routines before the bus, afternoon routines, take them to things like after school rec programs, help them socialize with peers in their classrooms, take them to swimming lessons, and maybe even some basic activities of daily living, like teaching them how to shower themselves, bathe themselves, get dressed in the morning, those types of activities. OPWDD is now not approving people under the age of 20. This is a significant hit for children who have disabilities or a mental illness because they can't access the service anymore. And that's what's happening with kids. So learning the disparity now that they haven't provided an alternate pathway for these kids to be funneled into. And so now parents are having to rely on a program called the Family Support Services, which is a reimbursement opportunity, meaning I have to pay the money out of my pocket and then get reimbursed. So if your kid wants to go to the Y, you pay up front, they will reimburse you when they get the receipt. It provides in-home respite. The other failure is in care coordination organizations. So I want to say about 8 years ago, words like the disco were being thrown around, and in our world, we were like, oh, hey, is this going to involve like a shiny ball? What's going on here? Totally not a shiny ball. But it really changed the way that care management services were provided. So they used to be called Medicaid service coordinators, and that shifted to care management. And so when that shift occurred, it was no longer about helping families in these crises to manage their Medicaid services. It shifted to a medical model for vision, dental, health, right? That is the exact opposite of what Medicaid service coordination was. And so again, now we have another gap because that hasn't been, no other plan has been introduced to support that loss. Right? So it's an amalgamation. It's kind of like when were they celebrating 50 years of Geraldo Rivera going into Willow Brick Homes to uncover the atrocities there? They didn't plan well for the deinstitutionalization, meaning now that they're not going to be institutionalized, where are they going to go? Group homes. And then we have the fight from the community, not in my backyard, they're dangerous. What are they going to do, right? And so again, when we don't provide the proper mechanisms or think about what the fallout is going to be when you take the funding or the resources away from the families, this is it. This is it. You have parents abandoning their children in the emergency room because they're not getting the wraparound supports they need. And I think that the education system is also part of this dynamic because, you know, part of their legal requirement when it comes to individualized education plans for people with disabilities is that they are required to meet the IEP goals. So often what we have is school districts suggesting that they don't have that service. That's not what the law states. You need to provide it. So if you don't have it, you have to go get it. Or what parents don't know is they have the right to go pay for it themselves, and then the school has to reimburse them, right? So we have this comedy of errors happening, and I call it passing the hot potato because it really comes down to who's going to pay the bill. And when the Department of Social Services starts getting emails from this treatment discharge planning from a hospital that's titled "Who's Paying?" that's the wrong message in my mind. That's not treatment planning in my mind. And so we're not engaging in those calls any longer. I feel as though if we don't start taking a stance on applying a shared accountability and shared responsibility to all of these people involved, we're going to really be in a crisis situation, because once this gets hold, I can only imagine how these instances are going to increase because the services just aren't there, right? Today I'm going to go on a home visit. Melissa and I are going to go visit that child's dad. I personally reached out to every executive provider that I know to ask if they would work with me so that we could get this child home. I met with mom. She was against it. She does want the institutionalization, but I wouldn't feel good with myself going to bed tonight thinking that a 7-year-old child would be institutionalized. I'd like to try to give it my best try to get this child home with one of their parents, but I needed to have some understanding to the people around the table that it's the legislative body and groups like Phil's that have to really bring to the attention to the state level the problems that are occurring when these types of shifts and changes happen to programming for people. So with that, just to kind of offset that, when we talk about our own DSS system and our structure and how we support people with the volume, right? Our foster parents aren't trained to work with these kids. So if in fact these parents refuse to pick up this child, it will default to us. The judge will determine that we have to take this child in our care. As soon as that happens, people who shift into foster care get no OPWDD services. That ceases to occur. So children who really require that type of service will not get it when they come into our care. And so when you talk about a child staying in a hospital, I know everybody at that table thinks once they get in our care that that child's going to automatically be picked up from the hospital the next day. And that reality, that's not accurate. We have to now find a family who can take on a complex needs youth child who maybe isn't sleeping 3 nights in a row. So it puts a hardship and strain on our system because this ends up being a local share cost, right? Because this was not the plan. The plan was that the entity OPWDD was going to care for their children, right? And so the reality is with the funds dwindling the way that they are, we are going to see a big increase on us having to figure out that problem, just like with our crisis respite RFP that we put out. We didn't get any takers on it, okay? So I just think that we're in for a rocky road ahead, and when we talk about our department, Phil, you shared or I think it was Rich, I'm sorry, Rich shared the annual report that was put out that identified Erie County, Oswego County, and who was the third county?
New York City.
New York City. And they wrote a letter to the state to talk about the system failures. And we were named in there. And so when you look at the crises afoot and the system strain that we have Whether it is because we have so much staff turnover, is the workforce prepared, is the capacity there for our workforce? It's concerning. I don't want to say it's very crisis, but I just want to say concerning, put it on the radar that this all has an impact on our performance, right? And so one of the things that from the beginning I had recognized even through the interview process before I took this job was the compliance, the quality assurance and compliance aspect of it. So we have a director now over quality assurance and compliance, and Tiffany has been hard at work doing audit and fiscal development. And so we did attend Munis. One of the trainings that Tiffany went to was utilizing something called Cubes to enhance fiscal audit capabilities and data validation. She submitted an interim transportation agreement for New York State related service needs to support continuity of operations. I don't know if I'm saying that right, Tiffany. Workforce development and safety completed 6 days of therapeutic relations at Universal Safety Training Trust. Again, so when we talk about the competencies of our staff, this kind of training is essential for frontline workers, whether they are going into the homes of people or they're sitting at our front desk in our lobby. And so recognizing that we have to strengthen the workforce to be prepared for what's coming. She did achieve her certification. She passed the test, and let me tell you, they put you through the rigors on this one. And we will begin training staff internally to establish a standardized trauma-informed approach to crisis management. This initiative is intended to enhance service delivery, staff safety, and situational awareness agency-wide. CPS case practice and school communication audit. So we meet quarterly with the superintendents. As a result of that and the feedback, Tiffany did conduct an audit on case closure notifications to school district based on concerns submitted through the interagency referral tool, which is pretty cool. QR code now we have, and a little form that the school districts can complete. Very effective and efficient. And so the findings were required school communication prior to case closure was not consistently occurring. And so there was a plan of correction, procedure standardized, and the impact is it strengthens our interagency communication, reduces duplicate reporting, and supports continuity for children and families. The family service QA audit, supervised visitation audit identified high cancellation rates for supervised visitation. So this is one of the things that when we talk about contracts that we're discussing, when we I think it was Sarah brought to our attention the number of visitations that are not being met. And so we kind of wanted to, why is that? Why are all these being planned and then they're not making it? So the key driver was limited availability outside standing working hours for parents. So yeah, if we're not offering evenings and weekends, that's pretty tough for families. So our next steps are exploring service model adjustments to better meet working families' needs and improvement of engagement. Although the contracts do identify evenings and weekends, if you don't have staff who work evenings and weekends, it's just not being provided. So this is one of the things that's on our radar. Recidivism analysis and service model review. We did meet as a team with the service directors, Sarah, myself, and Tiffany, to review trends in repeat CPS involvement. So I know it's always at the top of people's mind. How do we stop these recidivism? Because of course in the report and other reports were identified as having the highest recidivism rate. And so why is that? And so the top recurring factors that when Tiffany was able to look at some of the concerns, inadequate guardianship, inadequate basic needs, food, shelter, clothing, and parental substance use, which is totally in line with the things that we've been reporting on. But we're looking at evaluating bringing select services like parent education, looking at that contract, increasing completion rates, reducing costs. Notably, only 4 of 60 families successfully completed the most recent contracted service cycle. So there's little positive outcomes happening for contracts that cost us a lot of money, right? And so having to try to work with the providers for them to be focused on analyzing the data, right? It's not enough to just collect it. You have to do the work of understanding why and how do we need to change the service, what do we need to do. So we also did start the staff feedback focus program for operational improvements. 17 staff submitted, 53% directly impacted service delivery. The key themes were training and communication gaps, workflow clarity and process ownership, workload, staffing, and supervision challenges, policy versus practice misalignment, which are all things that we have been working on. The Department of Social Services has over 60 programs and services, and so it might take me 15 to 20 years to get it all worked out. But I'm kidding. I won't be here. It'll be somebody else's. But you can imagine the task of saying when we haven't had those kinds of process procedures aligned with the policy, that this is a big undertaking for us to get this organized. But we have made some positive impact with what we've done so far. The leadership team categorized each item for action, resolution, and regulatory limitations. The actions, resolutions, and regulatory limitations will be shared out quarterly in a quarterly report to all staff beginning in June. So we're being very transparent about what we are doing. I think it's important that the person who's the boots on the ground understands what's happening across the board. CPS case closure oversight model, QA and compliance currently oversees 95% of CPS case closures. Strength, improved timeliness and consistency, challenges, creates bottlenecks and limits skill development for program staff. This is something that we talked about regarding, the idea that it takes 5 years for a caseworker to be an effective caseworker. We don't have staff staying for 5 years anymore, so that's presenting to be a big challenge for us. So we have to look at being able to ensure that a staff's competency can be where it needs to be at the end of year 1, as in much of any of the positions that you take at the county level, you have a year, right? And so I think if we can improve how we train staff, the training that we, taking the model and turning it around, which in this report that was shared, it identified that the state training isn't enough, right? So agencies have to provide the additional training in order to support staff in the field. And so that's what we're going to do. And so there likely will be more information coming forward about how we're restructuring things at DSS as it relates to all of these very connected ideas and the impact for us and casework, because we realize that the case closing team is doing a good job of closing cases and making sure that new cases coming on are remaining timely. So that's great, but we still have overdue cases. And it's creating a bottleneck because what we've done effectively is we've robbed from Peter to pay Paul. In order to create that team, we had to take people who are out in the field doing field work and take them off to do the closing work. And so it's helped, but it's not the solution, right? And so we really have to front load our team, not back load it. So the idea will be that those QA teams will transition out of doing that closing stuff, and it will be Tiffany's team. They're not closing cases, but doing review of closures to review our efficacy in how we closed out those cases, if that makes sense to everybody. And so we will be transitioning to a secondary level review model to build capacity among senior caseworkers and grade B staff. Education, compliance, and interagency coordination, collaborated with OCFS and NYSED to clarify regulatory requirements related to sharing educational records, IEPs for children in the Commissioner's care. Issued guidance memo to all school districts on 4/24/26 to standardize expectations and support best interest determinations. Reimbursement and policy alignment educational placements. Reviewed the LDSS 3424 notification process for children placed in residential treatment centers with IDPs, finding potential reimbursement opportunities were not previously identified or communicated to fiscal. So this is a good one. Next steps will be clarifying the reimbursement requirements with New York State, updating internal policy and procedures, and aligning fiscal to ensure maximized reimbursement moving forward. So Tiffany, what did you say to me last time? You're trying to get me the money. So she's looking at all of the little things that I like to call the low-hanging fruit, where if we can establish these standardized processes, we can draw down more funding. Or when we look at contracts and look at how services might be provided, looking at the, what is that place?
Just the FIPSA clearinghouse.
The FIPSA clearinghouse, because they have opportunities. If we had programs and provide evidence-based training, that we could draw down funding to support that. So we're kind of looking at a couple of things that are in there now that we might be able to take advantage of just by thinking outside the box and looking at what our current needs are and how that might help us to achieve closing some of the gaps that we have. Legislative, how am I doing? Legislative engagement and opportunity. So I am doing the coffee with the commissioner. I find that, I'm trying to be proactive, providing a forum. I realize that people do have questions here that they're asking, and I feel like that is a great way to get some information on the table, to talk about it there before we go into this meeting or legislative meetings, so that people have the information and tools that they need to have, to support early dialogue, right?
Lee, could you mention when the next one is?
Yes, so have we sent out the invite yet?
Today's when it's all due.
Today? Okay, so
But
today.
it's generally the same time of the month, the same day, right?
Well, what we do is we send out a little thing, we offer a couple of dates, and then based on the responses of the survey, what is the best time? I don't want to, I can't do every time spot, right?
Right.
So we try to pick which one will be the most populated. Right now, I have 4 people interested, and it looks like it will be May 18th at 3 p.m. Unless we get more respondents to respond to the invite, we put out one for a 9 a.m. or 3 p.m., and the majority of people could do the 3 p.m. one. So it looks like that will be the one that we'll do, and it would be at DSS. And if there's any information that you want to talk about, and you want to give me the heads up before you come, because again, it'll be Sarah and I, it won't be my team of people. So if there are some topics that you think I might have to, inquire with the team about so that I can be prepared for a good discussion, let me know in advance. I'm more than happy to sit and talk and try to have a better understanding of, the issues out there.
Okay.
This goes back to when you were talking about all the services that were provided when you were in the field, and all the shifts of availability of services and what's covered and stuff. When did those shifts start happening?
So I want to say care management service coordination shifted somewhere around 2011 to care management organizations. And the idea of that shift was that Previously, Arise had embedded Medicaid service coordinators. OCO had embedded Medicaid service coordinators. Access CNY had it. Every agency had their own Medicaid service coordinators. And I think the idea was that it was a conflict of interest. So it was supposed to resolve a conflict of interest by creating care management organizations. But I don't believe it did that.
So, and then issues around what's covered was also starting to change in 2011 and all.
No, I think more recently, so family support, I want to say 2024, a significant change occurred with family support services.
And those are federal issues, right? Those are federal.
Family support, it's a mix because it does have some Medicaid implications in there as well. So it's a mix of state and federal funding. And so, again, the restriction of who can qualify. So to give you an idea, in February of 2024, when I worked at Oswego Industries, I had over 600 families enrolled in that program. The year they changed the regulation and guidance on it, I had 3 people left in the program.
Well, what I'm getting at, and also the issues with SNAP, and what's happening with the funding and the work requirements, which increases your job. It seems that it can be related to what legislation in 2024. And just from my perspective, we need to recognize that our congressional person supported that change in legislature. And I didn't need to say that because I know that it was brought up saying we need to be prepared for these cuts. This was back when I was not a legislator. I sat in the back and somebody said, we need to be prepared for what's happening. This was like in February or March of last year. And it was stated, oh, well, let's just wait and see. Things will work out. Well, things are not working out. And we need to recognize the impact of that legislation that came through and hit our services and hit SNAP. And now we're crying, help, we need more time. And it is a horrible situation and we need to work on it, but it's the most vulnerable people that are being hit by these shifts and who qualifies and how much money is available and what's required in order for these fewer people to get that need. And so it's like we need to be honest and know how some of this all came about.
Yeah, and that pendulum in my career, has shifted, right? So when I entered the service industry in the early 2000s, late 1990s, it was very much a medical model. And then we started to shift towards this individualized, person-centered model. And now when the funding dries up, pendulum slips towards the medical model. When we've got the money, now we can look at what people actually need, right? And I think it's just a sign of the times. It's cyclical.
Yeah,
So, as we can see from how long your update was, DSS is a big beast.
Yes.
So I would encourage you to go one-on-one, do the coffee with the commissioner.
No, I have done that. I just needed
program.
I wanted to just on the record say we need to recognize where some of these problems have come about.
Yeah.
Okay.
I have a quick question for you. You spoke of a program that had a success rate of 4 of 60.
Yes.
What was the cost of that program? How much money did that program cost? Can you elaborate a little bit on that program? Sorry.
Without stating who the provider is, what is that contract there? I'm sorry, we looked at 3 different contracts related to that service. There were 3 different contracts, $850,000.
And that was pastor money or that was county money?
No, that's 62% reimbursement.
It was 62% reimbursed. So do we have a plan in place to remedy that issue? I mean, 4 to 60, that's less than 0.5%.
Yeah.
It's less than 1%.
Yeah.
So do we have a plan in place to remedy that problem? Is there any?
I have some ideas.
What's your ideas?
Because I think that's the box, right? And that's part of what I'm looking at the FIPSA funding to see if there's additional funding, if we were to bring something like that back home and say that we would provide that service, right?
So you think throwing more money at it would actually resolve the issue?
No,
I mean,
I think we have better
percent is a
control.
lot of money.
Yeah, I think better control if it were to be brought in-house for us to be able to provide the service versus the provider.
And the FIPSA is the reimbursement piece.
Can you say that one more time? I'm sorry.
The same money, she's saying the vendor isn't doing their job, getting us results.
Well, for
Yeah,
me,
maybe
it's
bringing-
2%, 850,000, we're getting a 4, and instead we're getting less than 1%.
So the
We
FIPSA
need
is
to
the
start
federal,
adjusting how we're spending our money.
it's the
Yeah.
Federal Family First Prevention Services Act. And if a program on the clearinghouse is evidence-based.
Okay.
And we incorporate it, instead of just the 62% reimbursement, we get 50% and then 62% of the remaining 50.
Okay, so we get 50%.
No, so what we're saying is, yes, that's an underperforming agency.
Yes.
Right, they're underperforming. We feel like we could perform better, right, bringing that back. But in addition, looking at that clearinghouse to say, okay, now we can get 65, but now we can get an additional 50%
Sure.
if what we implement is an evidence-based practice.
Okay. And-
50% on the local share,
Share.
just to be clear.
Okay.
So it would be
And
additional reimbursement.
we would be able to, I would be entitled to get that money reimbursed us if the county to take over this program.
Yes,
And we implement.
an evidence-based practice in providing the same service.
All right, thank you.
So that's
If
our
I'm
plan.
understanding the commissioner correctly, you got $850,000 contract that's not working out.
Mhm.
Keep that $850,000, bring the program in-house.
Same money.
We still get the 62%
Right.
reimbursement, but the way she implements it in-house gives you another 50% of that remaining 38%.
Sure. Sure.
So perform better and also bring more money.
Right.
And cheaper.
Joe, you're next.
So on that operating, 16% vacancy rate, and then you're saying you're switching people around to cover other bases, right? Like you gotta
I
hold
think that
people.
was for different,
From the field to the.
that's under fiscal and finance. So they're saying they're operating with a 16% vacancy rate.
Oh, that's not on the,
Yeah, so that doesn't have anything to do with,
with like counselors and stuff, counselors, people that work with the families,
no,
that's something else.
yeah.
But you said you are switching people around all the time?
So I think you're talking about the robbing from Peter to pay Paul comment.
Yeah.
And so it's just how I deduce things. I'm a very colorful speaker, sorry. So when I came into the agency, I was under the understanding that there were 9 grade B supervisors, right? So I'm like 9 grade B supervisors, and then we have how many senior caseworkers?
Total between both is
26 total grade Bs in
between
both?
family and, yes, yes.
Okay, 9 and then 26. And then each senior caseworker has 15 people on a caseload. So 5 staff report to a senior, and then the senior reports to a grade B. And how many seniors to a grade B? 4 to 5 to a grade B.
What I'm just what I'm getting at is that over a month of a year, over a period of a year, is the same caseworker working with the same family, or are you breaking it up? Is it fragmented so that family doesn't get that support for 12 months
Sarah,
from
you'd
one
be better-
caseworker?
So family services has ongoing open cases. CPS cases are supposed to be closed after 60 days. So those caseworkers and their involvement. Services caseworkers stay involved unless they leave the agency or something happens where we have to switch out.
Where you're switching people out.
Yeah.
So one family might not get that caseworker for 12 months, right? If it's for 6
Well,
12 months.
hopefully they're
However
not
many
that
years.
long, but yes,
Months.
So if you have staff turnover, which is
Because I'm just focusing on, it's more,
the quality of the
what,
service for the family.
yeah, your service would be
Yes.
more quality to that
Yes.
family if they had a constant,
Yeah, and that
Consistent.
involves retention, right? That involves providing the proper training to staff, the appropriate level of supervision, right? So right now, you have, and my comments about rounding for Peter Pay Paul is not all of those 9 grade Bs are actually doing the same work. Some of them have been peeled off to do closing, some of them were peeled off to do the quality assurance, and so in reality, you only have 3 grade Bs, and they're not closing cases, and that's what we're looking at. We're looking at saying, no, we need to front load the front end, get those people to close the cases, so we don't have the volume of cases that are going overdue.
And that's actually to help with retention because you're spreading that skill amongst all of the grade Bs versus just keeping it with one, right?
Yeah.
So if the one in QA, she can retire any day. It's not really doing the other grade Bs any service if they're not being trained on that piece of it. So that's what we're trying to do is spread the wealth.
Spread it out,
Yep.
right? Yep.
And I do want to add, we do recognize that being consistent with a caseworker is really important to families. So
Correct.
when we do have caseworkers who leave the agency or take another role, we try to keep that family on the same team who has the same supervisor. So there is that level of understanding.
Thank you.
Well, thank you, everybody. Looking for the appropriate motion.
Motion to adjourn.
Second.
If you have any questions, you can go one-on-one with these folks.